Hi, I'm Dr. Ashish Gupta, and welcome to the next edition of the GRACE video series on the role of complementary therapies in cancer. We are very lucky today. We are very lucky today to have Dr. Urvi Shah with us today from Sloan Kettering Cancer Center in New York. She's an attending physician in the myeloma service, and she's passionate about the role of nutrition in cancer, and is one of the top researchers in this field. Not only is she a physician, a researcher, but is also a cancer survivor. Without further ado, I'd like to welcome her so that we can hear from her. Thank you, Dr. Shah, for joining us today.
Thank you so much, Dr. Gupta. It's a pleasure to be speaking to you about this topic that I think so many patients want to hear about, and there's so little available.
Yes. Oh, no, absolutely. One of the most common questions as oncologists that we get asked after we're done explaining the basic, chemotherapy or the other types of therapies that we have available from patients is that is there anything else I can do for my cancer? Are there specific foods, for example, that I should be eating? So when you get asked that question as an oncologist, what is your typical response?
So I think, we have to think about it in terms of what stage of their cancer they are in and what's going on. So if they're very overwhelmed with a lot of the treatment decisions, I think first thing is to get them on the right treatment, and maybe in the next visit discuss this when they are a little bit more, used to what the therapies might involve. But I think that there is a role that nutrition can play in all phases of disease. So in prevention, even if they've had the first cancer, to prevent future cancers, also preventing other medical issues or lifestyle issues that may come up through cancer treatment. In the survivorship setting, so after their cancer diagnosis, again, to prevent relapse from this first cancer in the first place, but also any other cancer that may come up, and comorbidities like cardiovascular disease, diabetes, and other chronic kidney disease. These are things that often, as patients are living longer and better with our improved therapies, are often the reasons why they have medical issues and even increased risk of death from. And then the third area would be in the treatment setting, and I think that's the hardest one to study, which I think is how do we use diet and nutrition to improve the side effects associated with cancer treatments and allow patients to take the full doses of treatments and use all therapies available. And then also synergistically with immune therapies, as we know that diet affects the microbiome and immune system, and if we're able to improve the immune function as we're going through treatment, maybe we're improving outcomes too. And so with fewer comorbidities, as a person's healthier, they would likely have fewer side effects, tolerate full doses, and be able to go through treatment. So I do think it's important in every phase of disease, and is something worth talking about.
That makes sense. And so really the role of nutrition is in all stages of cancer. Okay.
Yes.
When we hear the word nutrition and cancer, what is the basic relationship between these two things? How would you explain that?
So actually, the American Institute of Cancer Research has talked about this and say about a third of cancers, or 4 out of 10 of all cancers, could be prevented through diet, physical activity, and weight, maintaining a healthy weight. So that, we do talk about genetics, where yes, there are some cancers that are going to be inherited or things, but that's a really small proportion. Whereas in the prevention space, if we got lifestyle changes through populations, we could easily reduce, a third to quarter of all cancers in the globally.
Well, that's an impressive number. I mean, if we can cut down, there's over I believe 7 million cases of cancer in the US alone every year. If we can cut down, even a couple 100,000, I think that's a huge, huge number by the use of therapies like this.
And also with comorbidities rising, like, the obesity rates going up, diabetes incidence going up, these are all linked to cancer. And so as we see more of these chronic conditions, we're going to see increases parallelly with cancer. So trying to help patients maintain healthy lifestyles are going to help in everything.